Good morning, everyone. Thank you for joining us at the Rutgers Center for Security, Race, and Rights as we host a very important expert panel on a topic that continues to be timely, unfortunately, which is the politics of humanitarian aid and the devastating impacts on refugees in Syria, as well as displaced people in Syria. My name is Sahar Aziz. I'm a professor of law and Chancellor Social Justice Scholar at Rutgers University, Newark. I'm also the founding director of the Center for Security, Race, and Rights. And it is my distinct honor to serve as a moderator and participant in this panel, or I say a moderator in this panel, with some excellent experts that we have today. Before I formally introduce our panelists, I would like to encourage everyone who is with us today virtually to follow the Center for Security, Race, and Rights at csrr.rutgers.edu, and to also follow us on our social media, which is at RUCSRR. And if you use Instagram, it's at Rutgers CSRR. The Center for Security, Race, and Rights is the first and only human and civil rights center at a US law school that focuses primarily on the civil and human rights of Muslims, Arabs, and South Asians, both in the US and in the global East and global South. And so today's program is part of our broader mission to bring nuance, complexity, and deeper understanding of the diasporic communities and also the geopolitical context of the various countries from which these diasporic communities in the US originate from or immigrate from, because we appreciate that what happens abroad directly impacts the experiences of immigrants in the US who have ancestry in those particular countries. And so Syria is certainly one of those countries that has been in the headlines for various reasons since the Arab Spring of 2011 and even earlier. So today, I have the distinct honor again of introducing our three panelists. And the panelists are going to provide input and expertise based on their contributions to a very important book, which I would recommend the audience consider purchasing and reading, which is called Everybody's War: The Politics of Aid in the Syria Crisis, published by Oxford University Press. So I'll introduce the speakers in the order that they'll be speaking. So first we have a colleague of mine at Rutgers University. I'm very proud to have him as a colleague at Rutgers, Professor Omar Douachi. I was an associate professor of medical anthropology at Rutgers University and co-founder of the conflict medicine at the American University of Beirut. Professor Douachi is trained as a physician and anthropologist, and his work examines the social, medical, and environmental impacts of war on everyday life. His award-winning book, Ungovernable Life: Mandatory Medicine and Statecraft in Iraq, is the first study documenting the untold story of the rise of state medicine in Iraq under colonial and post-colonial regimes of rule and the consequent unmaking of state infrastructure and the exodus of medical doctors and expertise under decades of US interventions and violence in the country. Professor Douachi's forthcoming book manuscript is called When Wounds Travel, and it chronicles close to 10 years of ethnographic research and public health practice on the social ecologies of wounds and wounding, the rise of multi-drug resistant bacteria, and the reconfigurations of healthcare and humanitarian geographies across the east of the Mediterranean states. Next, we will have Dr. Duncan McLean, who holds a PhD in history and is currently senior researcher with, I don't speak French, so it's Médecins Sans Frontières, Doctors Without Borders, in Geneva for the UREPH. He has managed operations for MSF, for Doctors Without Borders, in both field and headquarters starting in 2002. Previously, he was a lecturer in history at Charles University and the Anglo-American University in Prague. And Dr. McLean has also worked in policy journalism and history, writing and publishing in all three domains. And our third speaker will be Dr. Aula Abara, she is a consultant in infectious diseases, general internal medicine at Imperial College NHS Healthcare. Healthcare Trust in London and an honorary clinical lecturer at Imperial College. Dr. Abada has volunteered in various humanitarian and refugee settings, including Greece, Sierra Leone, Turkey, and Jordan, undertaking direct clinical work, teaching healthcare workers, and building capacity. Since 2012, she has volunteered predominantly with Syrian governmental organizations, and her research interests include attacks on healthcare, antimicrobial resistance and conflict, refugee healthcare workers, and other interests more broadly relating to global and humanitarian health. And Dr. Abada co-chairs the Syria Public Health Network, which is the research led for the Syrian American Medical Society and is part of the Syrian Research Group at LSHTM. So as you can see, we have deep expertise on this panel, and we're very fortunate to be able to learn from them about the complexities of the politics and the social and political economy of the Syrian conflict, particularly through humanitarian aid lens and through the provision of medical services. So with that, I am going to transfer the virtual floor to Professor Douachi, who will also be co-moderating the panel with me. Professor Douachi, welcome to CSRR, and we look forward to hearing your insights.
Thank you so much, Professor Aziz, for this generous introduction and for the work that you do at the center. And I feel very happy and proud to be joining the center actually recently. And so this is a wonderful kind of inauguration event, despite the fact that the topic is really disturbing and solemn. So what I will do, maybe, I don't know if we want to ask the panelists to kind of turn on their videos, just to kind of join the conversation. So what I'll try to do today is to wear different hats. One thing is I'm going to speak a little bit, contextualize some of the book and it's kind of the project itself. Then I will speak a little bit more on contextualizing the conflict and why the context of the region and the history of healthcare and politics in the region, and more specifically in Syria, was so important in understanding the complexities of the conflict and the unfolding of events that followed over the past 11 years. The last thing I want to do is to maybe highlight some of the central arguments that I and my colleagues have contributed, at least in the chapter that I've written, my chapter. And so let me show you first the book. This is the Everybody's War book. It's really a fantastic effort by an organization like MSF that has been kind of so deeply involved in this conflict. And I think what the book does, which is mainly co-edited by members of MSF, those of whom these members have been involved in that whole history from the beginning, and what the authors and the organization wanted to do is to bring in scholars and practitioners to think together about some of the main public issues related to the war in Syria, from sociological history to questions about human rights violations, to the issue of attacks on healthcare. And so the book, despite the fact that it comes from MSF, it has also a very critical view on the role of MSF in this conflict. So, and this is something I think, I have to always give it, every time I speak in an MSF event, I highlight this as something that MSF does very well, which is its ability to be very reflexive and very critical of its own kind of practice, which is something I feel is more or less unique to that organization. So the book really gets into has different chapters. Each chapter is kind of written by either a group of people or one individual, but it does come basically in the context of the kind of the 10th anniversary of the Syria war. And this now we are even beyond that. We are now entering the 11th year of the conflict, which has gone through different phases of violence, different geopolitical kind of configurations, and different disruptions to the Syrian society, both inside Syria and outside Syria. At the current situation, people probably have heard a lot about the displacement or the exodus and the refugee conditions of the Syrian population in Europe, and of course across the region. There are close to 5.6 million or more than 5.5 million people who are been displaced outside the country, and close to 6.5 million or maybe less than 7 million people who are displaced internally within Syria. The loss of life, the morbidities, the injuries, and the kind of the social wounds that had kind of shaped this conflict is really unimaginable and has been very drastic. And kind of healing from this in the next decades will be so much of a challenge. So I think it is important for many of us to reflect on this, on the history, not only through a kind of an immediate and emergency point of view, but I guess also for many of us who've been dealing with conflicts for the past, maybe 30-40 years of our lives, just to also be able to contextualize and be able to reflect on where things are and why things came to be in the way they are right now. And one of the central ideas, and it kind of comes out from the title of the book, is just like everybody's war. And this idea that Syria has been a kind of a stage for a kind of a global conflict, and with a lot of geopolitical configurations. And the idea here is that there is a very strong regional dimension to this conflict, with different geopolitical entities, including Iran, Russia, Turkey, Iraq, Lebanon, the US, the different European countries are all been involved in this conflict in one way or another, either through funding one side of the conflict or contributing to warriors and soldiers and combatants. And also the entire region has been kind of taken hostage by this conflict and its ramifications. So it's very important to think, when thinking about the Syria conflict, is to see it as part of a broader global problem, and the way that implicated not only states but non-state actors, including humanitarian organizations, including also different militant groups that have been working or kind of conducting their work across the region. So this is also like what I want to also focus here is that historical events are very important in understanding kind of some of the transformations in the region. And one thing, I am not necessarily an expert on Syria per se, but over the past I guess 20 years, I work mainly on Iraq, but my understanding of what's going on in Iraq became so predicated on what's going on in Syria, on what's going on in Lebanon. So over the past decades, my understanding of the relationship of politics and healthcare has been always seen through a certain kind of regional perspective. Mainly if we want to understand what is happening in Syria, we also need to understand what's happening in the countries that are neighboring Syria. So I would say one of the kind of two critical events that have defined the region over the past couple of years, past decades, sorry, is the US invasion of Iraq. And I think that that event really created such a disruption in the geopolitical and the geopolitics of the region, creating a lot of chaos in Iraq and allowing this kind of conditioning the rise of a lot of the militant groups that eventually became involved and implicated in the Syria conflict. It also created a kind of a new alliances in the region, and specifically facilitating the geographical connections between the Islamic Republic of Iran and Syria, which was very also very important in the way Iran became implicated in the conflict, and Iraq also, a lot of the militant groups in Iraq became implicated in that conflict. So I think that event really was very important. It conditioned the possibilities of these kind of geopolitical alliances. And the second important event was the Arab uprising, or what was called the Arab Spring back then. And that event, which started in 2011, spread like a kind of a contagion across the region in terms of the emotional and political and social mobilizations that really transformed many countries in the region, as some of them maybe towards a better situation, but also it ignited many of these conflicts, including the Syria one. So what we saw in the post-Arab Spring is a kind of an incredible reaction, either from a kind of authoritarian states like the ones in Syria or in Egypt, where there was a kind of maybe transformation, but then a takeover by these authoritarian countries, or a kind of a civil war unfolded in relationship to these events. So what started at a lot of these countries as peaceful protest or kind of demands of social reform ended up becoming a kind of a militarized events, militarized crisis, where that has been unfolding for a really long while, and until now there is this problem of what do we think about these events and how do we understand them in the present? Are they part of a longer process that of change and transformation that's going to happen, or these are already kind of can be deemed as failure? So there's a lot of questions, at least in that world of analysis, that is trying to think about how do we understand these Arab uprising events, and to what extent they've been shaping the present and on the future of these areas. So the situation in Syria also, in the more specifics, also had very, there is a long-term history of a dictatorship that has been running the country for a long time, and also Syria has been defined and constantly by social and economic processes over the past decades. And I think, Duncan would probably going to be speaking about some of these economic transformation, but also I think it's important to highlight that some of the environmental changes that transformation that has happened over the past decades, including kind of problems with agricultural availability of water, has pushed a lot of population, especially in rural areas of Syria, into poverty and to migration. And so there has been a kind of a major socio-political upheaval happening due to a lot of the government economic liberalization policies. And I think Duncan would probably speak more about that in his presentation, and there has been a kind of transformation in general in environmental ecologies that has also created many problems for rural populations, and a lot of the tensions that one sees unfolding in Syria right now over the past decades had to do also with tensions between urban areas and rural areas, and the rural classes and urban classes. So there is a lot to really be explored and understood before being able to kind of really come to fathom the complexities of the Syria conflict. One of the central problems that I guess kind of pushed an organization like MSF to work on developing a book about the conflict and the Syria crisis is it's one of its major characteristics is the attacks on healthcare. And so what we saw in this conflict is is that a lot of violations of the humanitarian international law happening by the regime and by other actors in the conflict. And this became a kind of a major issue for a major issue of contestation, mainly because the IHL, or international humanitarian law, became a central kind of piece of international law that became always kind of raised during these past decades of events, where we can see the criticism is that healthcare should be neutral or shouldn't be violated, or healthcare professions shouldn't be attacked, or healthcare institutions and infrastructure shouldn't be attacked during conflict. So there is that kind of sentiment and discourses around international humanitarian law that really kind of looks at these attacks on healthcare as a violation of this problem. So what my contribution and my colleagues' contribution, Fuad Mir'i and Jonathan Whittle, the three of us wrote the opening chapter for the book, and basically it's a chapter that deals with the history of healthcare and politics in Syria. It is triggered by the question that much of the assumptions about the attacks on healthcare were assumed that healthcare practitioners or healthcare organizations were just kind of a neutral actors in the conflict. So we try to complicate, not in any ways condoning these attacks, but in many ways contextualizing why healthcare was so central to the history and to the sovereignty of the Syrian state. So we do a historical overview of the role of healthcare in Syria from the French Mandate until the present day. We show in the chapter how since the kind of the creation of the colonial state and the post-colonial and carrying over through the post-colonial state, healthcare has been a highly politicized platform for state making and for governing. So this is one point. We go through all these different kind of periods of time showing how the state, be it under the French Mandate or the post-colonial or under the Ba'athists, were constantly using and constantly paying attention to healthcare as a central platform for control, but also for building the healthcare infrastructure in Syria. And of course, for those who know some of the history, healthcare in Syria used to be compared to a kind of very well-developed systems. Syria had some really incredible pharmaceutical industries, training of incredibly talented physicians and experts. But we can see that over the past decades prior to the conflict, some of the unraveling of the social fabric in Syria happens due to some of the liberalization politics that the Syrian regime taken over since the 1990s and going through the 2000s after Bashar al-Assad took over the presidency after the death of his father. So I will basically end here and kind of just say that I really highly recommend looking at this work, because it does contextualize this conflict in different ways. and it brings in incredible scholarships of people who've been working in the region and people who on the region and people who are practitioners who've been involved in the kind of the unfolding of these last decade of the conflict. And thank you so much.
Thank you. Thank you, Professor Douachi. We will now pass the virtual floor to Dr. McLean, and you have between 12 to 15 minutes to speak. Thank you.
Thanks. I'll do my best. So thank you for the kind introduction, as well as the invitation to speak today a bit about some of the research and the research I've done on the Syrian war economy and the chapter specifically for the book that Omar kindly introduced. I start this talk with a bit of a disclaimer, but I feel better saying that at the start, because while I'll be discussing very, let's say, economical issues, I've also spent a number of years in the region and multiple visits to Syria, and I think when you speak purely about economics, it's a bit distracting from a lot of the issues that Omar was mentioning. So it's not to dismiss in any way the situation on the ground in Syria and neighboring states, and especially what was being discussed, displaced, and those that have been forced to cross borders. Having said that, I've given a very, I would say, almost cold-hearted economic analysis, numbers analysis, looking at some of the tricky issues that humanitarian organizations and MSF in particular have faced there, and I'll go through some of the key points of the chapter of the research that I've done. I'll try to keep it brief, as I said, but I'm very happy to expand on any of the issues I raised during the Q&A afterwards. So I start with a quote, a citation, the only one I'll give you, I think, in this 12 to 15 minutes I have, and it's an old one. It's from 1935, but I think it really captures. So I would say the war economy dynamics over the last 10 years now, going into 11, as we say, in Syria. War is a racket. It always has been. It is possibly the oldest, easily the most profitable, surely the most vicious. It is the only one intentional in scope. It is the only one in which the profits are reckoned in dollars and the losses in lives. So that comes from an American Marine, Major Smedley Butler, reflecting on his career in primarily Central America and East Asia. But when we look at the war economies today, I think that still is accurate almost 90 years later. So I think the first obvious point, and I try to keep it not too academic either, but what are we actually referring to when we speak about the war economy, Syria or elsewhere? And I would say the more technical definition is a generation, mobilization, and allocation of resources to sustain a war effort. So that's it's quite simple and basic and misses a few nuances. And I think there's one very, very important nuance when we speak about war economies, and that is that it can also include, or it does include actually, the economic activities of civilians, of individuals that are trying to survive, that are either contributing intentionally or unintentionally. It's essentially survival economics. And this also includes the activities by relief organizations, by humanitarian organizations that are trying to assist them. So it's beyond just simply stocking the coffers of opposition groups or governments. It goes far beyond that and sort of filters down to all levels of society. So the other, in the second disclaimer, I was saving it for after the small definition, is to give a very humanitarian perspective, or at least through the lens of a humanitarian organization, about what we mean about war economics. It's also important not to be naive. I think we can be a bit naive at times. You take any conflict on the planet, there is a war economy. It is required by all groups to sustain in some way or another their activities. And anywhere that humanitarian organizations are present, and this is pretty much everywhere to different degrees, they're a part of that system. So it's not to be naive and somehow imagine that, and I think of Omar's comments on neutrality, that you can somehow imagine that you are in that landscape, but you are apart from it. You rent a house from someone for an office to transform into a clinic. That money is going somewhere. But the general calculus is that the benefits from having a clinic there will justify the expense and the fact that you don't really know what happens to that money. The particularities of the Syrian conflict is it has arguably been taken to another scale, another level, and it's raised, I would say, awkward questions that have always been there have been also raised to a different degree. So understanding the Syrian war economy, it's important to have a bit of an idea, at least of some key, say, recent historical trends or not so much events, but trends in the country leading up to the uprising and the conflict itself. And probably the most important of that is that in the decade or so prior to the initial uprising was a period of massive privatization in the country. And along with that, levels of corruption that also increased significantly as well. I mean, corruption also has a very broad definition, but when we talk about privatization and liberalization, it basically included most industries, telecoms, social activities. It was on a massive scale, and of course, those that were most able to benefit from that privatization was those that had the closest links to the government, to Assad's government. It also be pointed out that at the same time during this period of privatization, essentially, if we take probably the most classic indicator of corruption from the Transparency International, Syria essentially went from 120 to close to 190 on a list of worldwide countries. So clearly this went hand in hand during this period of privatization. So this was already the setting prior to the conflict actually coming out. The second point to mention, this is very much early on in say 2011, 12, 13, what's been described by some as the economics of chaos, meaning that some were in position to benefit most from the conflict and actually become rich from it, and of course pauperization of a large portion of the population. But the very obvious point as well is that globally, Syria's economy contracted massively during this time. In the first 3 to 4 years of the conflict, up to 60%. So the question is also raised: how has the government survived under those circumstances? So the answer is fairly obvious as well, at least partially obvious. Domestically, policies were put in place to reduce expenditures, so basically raise tariffs, subsidies were reduced, civil servants continued to be paid, especially in government-held territory. There was a tax clampdown on businesses to try and solidify the tax base. And on the other side, there was they had to replace traditional partners or supporters of the Syrian government. So, of course, Turkey and Saudi Arabia, as the largest, I would say, economic partners at the time of the outbreak of hostilities, were supporting opposition groups. So, of course, these were, to put it in very simplistic terms, replaced by the Russian Federation and the Iranians. Russian Federation giving access to banking services, particularly beyond military aid, and the Iranians providing enormous lines of credit, partially for the purchase of Iranian oil, but also for contracts for Iranian companies and so on. So these were absolutely essential in shoring up economically, we could say, when the fate of the current government was really under question. A third point that is particular about the Syrian war economy, and this again is if you want to look at medieval sieges, Leningrad in the Second World War, or up to the sieges in different opposition territories of Syria during the conflict, you obviously had war profiteers, those who were benefiting enormously from the conflict itself. And to the point that military initiatives became secondary to shoring up those economic bases. And again, I'm not only speaking about government, but I'm also speaking about different opposition groups in that case, which also led to a very, I mentioned neutrality earlier, a bizarre situation where some of those businessmen and women, primarily men, that were operating on both sides, opposition areas and government-held territory, were actually some of the more let's say, superficially neutral in the conflict because there was no interest in who was winning. It was quite simply a question of benefiting from economically from all sides. And we're actually operating both sides, as opposed to humanitarian organizations were in the vast majority of cases were restricted to working on one side or the other for various reasons, which we can come back to later if there's interest in the Q&A. And I think the particular, almost the caricature of this extreme was in the siege tactics. So in the research in the chapter, I look specifically at East Ghouta, which was certainly one of the most mediatized long-running siege that only concluded in early 2018. But of course, there were multiple examples throughout the country. The point being is that you very much had a intertwining of military and economic objectives in those cases. And then finally, the element of sanctions. Sanctions, it's important to make to nuance a bit when we refer to sanctions that were imposed upon the Syrian state, in that these were not UN-sponsored sanctions, they were Western sanctions. So this is primarily covering the US, European Union, some other states. Meaning that many countries continue to trade with the Syrian government, whereas as opposed to those ones that I just mentioned, who were obliged to follow those sanctions, which those sanctions actually had the inverse effect of empowering those who were benefiting from the war economy, because of course other elites had to emerge to be able to exchange with those groups. And in this case, the banking system, for example, that the Russian Federation put at the disposition of the Syrians was essential because there was no longer access to that in the European Union. So those are some of the key points. There are others, but we can come back to that later in the Q&A. But just to be efficient and go quickly, I focus a bit more on humanitarian aid and then say a few words about MSF and conclude there. So the vast majority of humanitarian aid that was directed onto Syrian territory was through government-held territory. That should come as no surprise now, given that the vast majority of territory is now held again by the government. But 5, 6, 7 years ago, of course, it was vastly unrepresentative of where the needs of the populations were. So it remained about 90% to government-held territory, even if it was 50% at one point was held by other groups. Having said that, opposition-held territory, notably along the Turkish border, obviously benefit as well, whether it was through control of checkpoints, taxation of salaries, of imports that were coming in. It was not the exclusive domain of the government. And another point that was very much striking to me, looking at the humanitarians in general, and not just MSF, was the position of donors, and it was this bizarre situation of sort of passing the buck down the line, where donors would close their eyes to what was happening to large humanitarian organizations, who would in turn sort of blame it down the line. Well, once we paid the money, then it's this is the organization's responsibility. Who would then say, well, this is the local organization's responsibility. Who is so on and so forth. But basically, I wouldn't say blindness, but a collective turning the other way, because it raised too many awkward questions. And another striking point as well, when you look at humanitarian aid and the war economy, is the issue of fungibility. So in other words, fungibility refers to that. And this is something you see all over the world. That's certainly not restricted to Syria, but when the presence of humanitarian organizations, whether it's supporting medical services as MSF has done, food aid, non-food items, whatever, it generally allows authorities, whether they're state-run or opposition groups, to put their resources elsewhere. So of course, you have to say it's not the responsibility of a humanitarian organization to decide where government is going or not going to spend its money, but certainly the presence there and pouring millions into a specific area is not a huge motivation to become involved in the specific services provided. I think I have just a few more minutes, so I would just say a few words as well about MSF. So the reason I undertook this research, I was actually working more in an operational capacity when I was in the region earlier, but I was asked to look at this research because internally with MSF, we were asking some awkward questions about how about the programs that we were running. So for those unfamiliar with Médecins Sans Frontières, Doctors Without Borders, as a general rule, we try to undertake all our medical activities ourselves, which it doesn't mean international staff. It's the vast majority are actually locally recruited staff, national colleagues, with international staff in support. But the point being is that our teams undertake their medical activities themselves, often in collaboration with ministries of health, but we are not subcontracting out to others. So this is the classic model that we use all over the world in different capacities. In Syria, this became increasingly challenging for all sorts of reasons. There are security reasons. We've had staff kidnapped, arrested, killed, structures, medical structures bombed, and so on and so forth. So it became very, very difficult to undertake those let's say the classic modus operandi that we would use. On the other side, trying other different models were ineffective, and seeing the extreme needs, notably in besieged areas. We basically followed a trend that we see with many other organizations, that essentially we were providing material and resources to be able to continue running medical services in those besieged areas. So again, this is not a particularly original approach. I think we're very, very late in taking that approach, and we do it very, very early. But in this case, it created some very, very awkward questions. Already the organization was uncomfortable, to say the least. We also saw in the space of a relatively short space of time, our own budgets multiplying exponentially for all sorts of reasons, and it sort of made us want to look more carefully at how these resources were being used. And the thing that is quite striking is areas or context of where you're dealing with predatory groups is not unusual at all, certainly for MSF. But when you're looking at sort of one-off events, whether it's vehicles being stolen, a warehouse being looted, a hospital being ransacked, you can put your finger on it quite easily. I mean, of course you do analysis. You know, what could we have done differently? Some things you cannot are simply unavoidable because the front line will change. But the point being is it's specific events that can be analyzed as such. But rather in the context of the support we were trying to provide within Syria, it was much more systemic rather than one-off. So of course there were incidents of looting and so on, but it was rather it was much more, I would say, nefarious and subtle. And we're a bunch of doctors. We're not political economists, so it's not a simplistic analysis to undertake. But just whether you're looking at the multiple exchange rates being used in Damascus, having to buy material, medicines on the local market. Irrespective if it's being bought in besieged areas or in government-held territory, there's a write-up to get it into the areas with the most need, whether it's using Hawala banking system, as for this essentially an informal banking system to get into the country, or salaries incentives. All these elements contributed to the explosion of budget, and that's raising very, very difficult questions about are we actually doing more harm than good? So in the broad scale of things, I would still say, and this is not an excuse, we were a relatively small fish in that context. But at the same time, it did raise questions about how far you can really go in a context where humanitarians were described, notably by people that I interviewed. You know, you're a pretty small fish and you're useful idiots, but at the end of the day, the broader dynamics of the conflict are well beyond yourselves. So I'll stop there and be happy to expand on any of those above points when we get into the discussion. Thank you very much.
Thank you, Dr. McLean. And now we will turn to Dr. Abara, who will be our third and final speaker, after which we'll do Q&A. I will let everyone know we have a hard stop at 11:45, so hopefully we'll have enough time for some conversation. Okay, Dr. Abara, the virtual floor is passed to you.
Cool, thank you very much, Sahar. And I can try to be short because it would be excellent just to get lots of discussion going and to expand as to what's been discussed so far. So what I'm going to focus on, it draws very nicely from what Umar and Duncan have been speaking about in terms of this politicization of this protracted conflict, but I'm really going to do it through the lens of the so-called politicization, fragmentation of Syria's health system or health systems, and their varied health impacts and the complexities that they present for the health and humanitarian response. We've heard nicely from Duncan about the role of Médecins Sans Frontières, but actually the humanitarian field across Syria is very complicated, and more so because of the geopolitical changes in the country and the subsequent health system fragmentation that has occurred. I'm going to try and reflect a little bit about what this means for the way forward, though I have to say, as a Syrian who continues to see suffering almost on a daily basis, whether it's ongoing attacks on health, ongoing attacks on civilians, on detention centres, a cold snap, it seems very hard to see an end to the suffering and the complexity of this situation. As we've heard from Umar, it was early in the conflict that healthcare came to the fore, and I think it's important to reflect about healthcare workers. In Syria, the way healthcare workers are viewed, and it would be great to think more about healthcare workers and how they are viewed in Iraq, Lebanon, and in fact regionally, because there's a lot that we can learn. And I think it's rather different from how we function or are viewed in Western countries in terms of their role is stepping up into leadership positions, and that goes beyond healthcare. I think many of them were leaders even outside of the health sphere. But what that meant is early in the conflict, particularly in the northwest of Syria, as the Ministry of Health started to withdraw its governance, its rule, numerous organizations started to come to the fore. Many of them were humanitarian organizations, and actually, if we just look at northwest Syria and the health system or health systems functioning in northwest Syria, this is an area where there's about 4.17 million people, of whom more than half are internally displaced. We'll see that even within that, there's significant fragmentation. And then, as Duncan has nicely said, there's additional complexity in terms of the humanitarian response. And I want to reflect on that more because it's very pertinent. So what I mean by that is the issues around cross-border aid, the role of international organizations and their role in working almost through the local or Syrian non-governmental organizations or the expatriate Syrian humanitarian organizations, almost as conduits for delivering healthcare and delivering aid, running projects. And actually, this is something that Médecins Sans Frontières does in other situations, and there's important discussions in current other conflicts around this. But I think Syria has been probably a game changer in how that's functioned, certainly for MSF, but also many of the other international organizations. And so I want to draw on a little bit more in terms of what's happening across Syria. So when I talk about fragmentation across the country, if you think about the geopolitical areas, so areas under government control, which are now around 2/3 of the country, and as we heard earlier, they used to be less, but they used to still get disproportionately more funding, particularly from the international community. And then areas in northeast of Syria, and you should remember these were areas that were previously under Daesh and now sadly are facing multiple challenges. Currently the attacks around the detention center in Hasaka, but also significant impacts of the closure of Yarubiya border crossing. And I think that was early 2020 with significant health impacts in terms of COVID-19. And in fact, earlier this year, the border had been closed at the end of last year as well, interrupting the inputting of aid, much needed aid for the health facilities in the region. And then, of course, the northwest of Syria, which I have mentioned, which is an interesting area, probably among the most advanced in terms of the local health system and how the health system has grown. Before I talk in a little bit more depth about each of these areas, I want to reflect on, and sorry, I've lost my train of thought there. I want to reflect on what happened early in the conflict as the uprising started. So many healthcare workers started to respond, but early in the conflict, healthcare was criminalized. And so for if I were a doctor providing care to someone who was injured in a protest, I could be arrested. And in fact, the attacks on healthcare, the very deliberate, systematic attacks of healthcare across the country, more than 90% of which have been perpetrated by the Syrian government, has resulted in the deaths of at least 900 healthcare workers. You might be following what's happening in Myanmar at the moment, and there's a massive outcry about what's happening, quite rightly, with doctors. But in the last 12 months, 31 doctors in Myanmar have been killed in the course of their work. And of course, that's unacceptable. But Syria, and I can name other countries, CAR and others, where the attacks on healthcare have been so horrific, and in fact, forced doctors to leave the areas that they live and work, further worsening the situation in terms of health within Syria's borders. And as we look back over the COVID-19 pandemic, we don't know the number of doctors and health workers who've lost their life as a result of the very fair to say, very poor response across Syria in terms of the COVID-19 responses. And that's again put further pressure on the remaining doctors, their ability to provide healthcare to an increasingly desperate population. And by desperate, I don't only mean in terms of all the social determinants and in terms of poverty. So more than 80–90% of people who remain in Syria are well below the poverty line, also malnutrition, poor shelter, and the rest of it, being unable to access work and livelihoods, being forcibly displaced from their homes, losing their assets multiple times. But also all the other factors in terms of poorly controlled communicable diseases, for example, non-communicable diseases. I've got relatives who have needs in terms of cancer, and they have to travel between cities 2 or 3 hours at a time. Of course, it takes longer because they have to go through checkpoints just to access oncology care. And even when they can access it, and I describe them as the lucky ones, the medications may not be available for them. And of course, there's a variety of reasons behind that. What I will speak a little bit about is what the differences within the health systems within Syria look like. And so if we look at areas under government control, the health system in this area is obviously run by the Ministry of Health. And there are important pre-existing factors which have a bearing on the current health system and what the future health system in that area will look like. So there's a very heavy reliance, as with many other parts in the Middle East, on specialist hospital-based services, which are of course less cost-effective, more expensive, both for the service user, but also for the health system as a whole. And there's very weak investment in primary healthcare. And there's also geographical inequality, and arguably that is worsening. We've heard very nicely about some of the environmental impacts. So for example, there's been failure of agricultural crops, both before the conflict and now, leading to malnutrition. Some areas have suffered from fires, as in other areas in the Middle East, which has also caused destruction. And a particular area of interest for me is the attacks and interruption of water, or more broadly WASH, so water, sanitation and hygiene. An important example of that is in northeast Syria, where the disruption of a Luke water station, which has happened numerous times over the last few years, when it gets interrupted, it interrupts water to about 400,000 people who are already living in very suboptimal conditions. I'm going to speak a little bit more about the northeast of Syria, and I'm going to highlight again what happened as a result of the border closure. So if you remember to 2014, when the UN Security Council resolution came in saying that there will be provision of cross-border aid to avoid the issue whereby there has been politicization and differential delivery, not based on need, but based on political or geographical affiliations through the government. And so it never really reached the areas where it was most in need. Over the years, it's been subject to 12-monthly or 6-monthly renewals. And when the border, Yarubiya border crossing in early 2020 was closed, the idea was that aid would flow through Damascus and would reach these areas in the northeast, whereas of course we know that hasn't happened. And there's been important explorations from Human Rights Watch and others as to the impacts both now in terms of COVID-19, but the broader health and humanitarian effect. The last main remaining, and I'm going to stop after this point, the main last remaining border is the one in northwest Syria. And that's just been renewed, but again, come July 2022, that will again be under threat. And if you think about the area in northwest Syria, and this is where in some ways we cannot differentiate between politics, healthcare, humanitarian care, because of what's happened as a result of this conflict. If that were to close, we know full well that there won't be cross-line aid from areas under government control to areas in the northwest, given what's happened over the last few years. And so I'm going to end with saying, for me as a clinician, I never want to be involved in politics. To an extent, the idealist in me believes in neutrality, but unfortunately the reality in Syria and in other health systems in the Middle East is that we can't separate the two. And that's why conversations and in fact books like this are so important. Thank you.
Thank you so much, Dr. Abado. And thank you to Dr. McLean and to Dr. Douachi for these valuable insights. I want to thank you to all three of you for your insightful comments, and I know this is just the tip of the iceberg. I recommend those who want to know more to read the book, Everybody's War, The Politics of Aid in Syria, or excuse me, The Politics of Aid in Syria from Oxford University Press. I encourage you all to follow the work of these three brilliant scholars and doctors and researchers, practitioners. And then finally, I encourage you to follow us at the Center for Security, Race, and Rights by visiting our website, csrr.rutgers.edu, and joining our newsletter. And if you want to see more of this type of programming, I have to put on my executive director fundraising hat and ask you to make a donation. If you go to csrr.rutgers.edu, you press the donate button and give whatever you can. We intentionally want to keep all of our programs free. We are committed to educating the public, especially in the United States, but also abroad. And we thank you very much for spending time with us today to learn about this important issue and continuing to hopefully work together to defend the human rights of Syrians in this case and all people in the long run. So thank you to our experts. We give a virtual clap to everyone. Thank you. And we have another event at 12 noon for those of you who want to watch. It's with Masoud Hayoun about his book, When We Were Arabs, Jewish Families' Forgotten History. So hopefully we'll see you at our next event in about 10 minutes. All right, thank you very much. Ma salama, bye-bye.